Hi there, my name is Shelby Sioux and I'm here to talk to you about all things health and wellness. I'm an RN and I struggle with my own battles of endometriosis, PCOS, and IC. Recently I found out I have a dermoid cyst on my left side of my ovary with an incidental finding due to an MRI that I received for my right hip pain. And I plan on documenting my journey, so come along with me. Alright, I'm here at my doctor's office. I have an appointment to check out my dermoid cyst. Some questions I'm going to ask is how this could potentially affect my fertility as I've been trying to get pregnant. So that's a really important question for me to ask. Also, I'm going to ask her about the pain I've been having. She's obviously going to palpate my stomach. And I'm also going to ask why mine grew so quickly. They're not supposed to grow more than 1.8 millimeters in a year, and mine grew, like I said, 4 to 5 centimeters in just 6 months. So that's definitely a concern for me. Just being a nurse, I just want to make sure that nothing else could be causing that. Something that would be really rare would be like cancer, but again, all the forums I've read, that would be like super rare, and I think I would probably have other symptoms, but you never know. Ovarian cancer is silent and deadly by the time that is ever noticed. But I'm here to advocate for other women who may feel like this, may feel like, oh, it's nothing, oh, it's always benign. I always think it's good to get it checked out though, so that's what I'm here. I'm getting it checked out. I'm going to ask my provider about my pain, what to expect, why did it grow so fast, fertility questions, and then also hormones, like what's going on in my hormones that could potentially be causing this. And I will definitely be giving you guys an update when I come back to the car and let you know how it went. All right, I am back and ready to talk to you about my appointment at my OB's office. I see an OB that is very informative, listens to me, and I think that's really important. My advice to you would always be finding a provider that listens to you and answers every single question that you have. I had the opportunity to switch providers last year when I needed surgery for when I was hemorrhaging for almost a month, and my hemoglobin dropped really low, and she took really good care of me. So I trust this doctor, and I felt actually really excited about this appointment because this is one of the first physicians I have found in Western medicine that listens to me, and I feel like really hears me out and all my concerns that I have. So when I walked in, I said, hey, I have this dermoid cyst, I have so many questions, and she led with, why did you get the MRI in the first place? What led to this, and why did you have it? I got the MRI because I was having hip pain. We found out I had a torn hamstring along with some other stuff, but nothing really serious, and so that's why I got back in that gym, started working out, and I actually feel a lot better with my hip pain. Because of the MRI, they subsequently found that I had a dermoid cyst on the left side. It's 4 by 4.3 centimeters, and it was really awesome because in there we were actually able to see the physical copy of the MRI. We were actually able to see how big it is, and you can't actually see my left ovary at all, so I think it's kind of in the front hiding my left ovary, because I said, well, where's my left ovary in relation to this dermoid cyst? And she was like, I can't really see it, so that tells me it's kind of just in the front, probably covering my right side. She showed me the size of my ovary, and it appears to me, again, I'm not a doctor, but it appears to me that this dermoid cyst is completely covering the size of my ovary. So to me, it was significantly big. My OB said that she wasn't too concerned about it and that they usually don't do surgeries unless it's 8, 9, 10 centimeters long. I did find other articles that suggest once it's over 5 centimeters that you should do surgery. Kind of just depends, and it's patient to patient specific. I asked questions like, what kind of risk am I at for ovarian torsion? Does this affect my fertility? Does it grow bigger or stop growing if and when I do become pregnant? So I was asking questions that were very tailored to my fertility, pain, and protecting my ovary in itself. Because if you get an ovarian torsion, that's where it twists essentially and will cut off blood supply to your ovary, and I don't want that to happen. Because of the MRI, they subsequently found that I had a dermoid cyst on the left side. It's 4 by 4.3 centimeters, and it was really awesome because in there we were actually able to see the physical copy of the MRI. We were actually able to see how big it is, and you can't actually see my left ovary at all, so I think it's kind of in the front hiding my left ovary, because I said, well, where's my left ovary in relation to this dermoid cyst? And she was like, I can't really see it. So that tells me it's kind of just in the front, probably covering my right side. She showed me the size of my ovary, and it appears to me, again, I'm not a doctor, but it appears to me that this dermoid cyst is completely covering the size of my ovary. So to me, it was significantly big. My OB said that she wasn't too concerned about it, and that they usually don't do surgeries unless it's 8, 9, 10 centimeters long. I did find other articles that suggest once it's over 5 centimeters that you should do surgery. Kind of just depends, and it's patient to patient specific. I asked questions like, what kind of risk am I at for ovarian torsion? Does this affect my fertility? Does it grow bigger or stop growing if and when I do become pregnant? So I was asking questions that were very tailored to my fertility, pain, and protecting my ovary in itself. Because if you get an ovarian torsion, that's where it like twists essentially and will cut off blood supply to your ovary. So having one less structure, such as your ovary or ovaries, can affect your hormones, and I'm definitely young enough that I don't want my hormones to be affected by losing an organ such as an ovary. My poor left ovary. I have had it now cut open for my endo surgery, re-stitched back together, tacked to my abdomen, and endometrioma removed from it, and now I grew a darn dermoid cyst. So I don't want surgery. Surgery is definitely a last line intervention for me, especially after the complications that I had after my endometriosis excision surgery. I ended up with a full bowel ileus, and that's kind of where your bowel stops, it freezes, and because of that I was hospitalized, and it was not a good time. And so for me, I don't want to have another laparoscopic surgery where they go in, they investigate, and they remove that cyst. On top of that, I think I would be a much more complex surgery candidate because of my history of endo, and because I have had recent increase in pain. I feel like probably some of my endo lesions have grown back or are regrowing, and so I just feel like this 45-minute surgery, she said, that could result would end up being longer than just 45 minutes. If she finds anything, it would be her due diligence to go ahead and remove extra tissue, and she said that. So my options were like, hey, we could remove this, we could just watch it. I'm definitely in the boat to just watch it. On the lines of my dermoid cyst, she said, I think this is kind of just incidental finding. She said, I know you've been trying to get pregnant now for like 18 months, so let's talk about that. Which was really great. We were able to talk about the discussion of fertility and me getting pregnant, and I think that was really important, and she definitely saw my heart in that. She said, you've been trying long enough, and she said, if someone's not getting pregnant, why is that? Are you ovulating, which we have checked multiple times through labs, hormone testing, and ovulation kit tests? Yes, I am. And the other thing is the guy. What's the guy look like? What's his sperm count look like? What's all that look like? How is that situation going? And my husband, all his stuff is good. So it's the third option, which could be like hormonal related and or structural related. And I have had endo surgery and I've had tests, and this is where the OB and I kind of disagree. I strongly believe that I do have PCOS. I've been diagnosed with it in the past by another physician. Because my hormones look good and I don't have extra testosterone, she doesn't want to label me with a diagnosis of PCOS. However, I have multiple cystic appearing ovaries. So both of my ovaries have a lot of polycystic structures and hemorrhagic cysts, which is one sense of PCOS, hormonal imbalances, which I've had off and on, and irregular periods, which I've had my whole life until my endometriosis surgery. After my endo surgery, I finally had regular periods, with the exception of one hiccup last year where I was hemorrhaging for like 23 days. So, because of my endo being fixed and me having more regular periods, and because I eat well, eat healthy, and exercise, my hormones are pretty regulated, and that's because I do the work. Therefore, she doesn't want to give me that diagnosis. So that's where her and I agree to disagree just a little bit, but that's okay. And I am a nurse, so I do feel confident in what I'm saying. No, I'm not a physician, and I hope that nobody looks at this and thinks that I'm just like self-diagnosing, but it definitely is a layered diagnosis, and I think it's really important to consider each patient is different, has a little bit of a different story, and no two people may have the exact same symptoms of a disease process. Back to what I was talking about with the dermoid cyst and talking about fertility, the option she gave me is, hey, like, let's look at your fallopian tubes. During your endosurgery, did you ever have that investigated? Essentially, did I ever have dye put into the fallopian tube space through the cervix to see, like, are they open? Are they closed? Are they strictured and narrowed? I have a family history of someone in my family that had narrowing of their fallopian tubes and did have ectopic pregnancies. So that's always been a little bit of a concern of mine, but it's never been investigated further. If I'm being honest, I always thought with my ultrasounds, they were able to see blood flow in my fallopian tubes, and I always thought that was a green light and a good to go area. Looking back now, I kind of wish this was investigated sooner, because if I do have narrowing or stricturing, and that's been the problem the whole time, I feel like this would have been better managed if this was presented to me as an option earlier in me coming in for appointments for potential infertility or fertility issues. And this appointment was good because she knows I've been trained for 18 months. She knows that I've been tested with hormones, so is my husband. So now we're looking at structures. I don't want a laparoscopic surgery to get my dermoid cyst removed right now. So one of the options, since I'm not doing that, one of the options was if I did do that, she would go in while I'm under and inject dye through my cervix and look at the dye going through my fallopian tubes to my ovaries and seeing that there's no narrowing or stricturing like I mentioned. Since I don't want to do surgery, the other option is next month or in the next 2 months or whenever I decide on day 10 of my cycle. So day 1 through 5 or day 1 through 7 is typically your period. After that, day 8, 9, or 10 is usually when you get the injection of the dye done. You're awake for it. It is uncomfortable. And she didn't outright admittedly say, hey, like, this is going to be uncomfortable. I did have to ask that. I did have to say, you know, since I'm not going to be under, here's my questions. Who's going to be injecting the dye? And what does the dye see? I am going to be awake, and then they take an x-ray kind of underneath me and on top, and they scan a picture, and they see the flow of the dye go through. So I'll be awake. I guess a radiologist or radiology tech inserts the dye through the cervix while I'm awake, and they take a picture of the fluid going through my fallopian tubes and my cervix and potentially to my ovaries, and it'll let them know that it's either open, that it's closed, that there's good blood flow, stricturing or narrowing. The other thing she mentioned as well, which I haven't touched on yet, is if I have had increased growth or lesions of my endometriosis, that I could potentially have scarring and or endolesions in my fallopian tubes, and this would be a really good way to also see that. And I was curious because I know you can't see endo on really any scan. You can't see it on X-ray, you can't see it on MRI. Sometimes you can on MRI. It's very rare. And the only time you ever really see it in an ultrasound is when you have an endometrioma, so essentially like a sac that's filled with blood, and that's how I got my diagnosis of endometriosis, well, presumed diagnosis, because I had a fluid-filled space of blood, a sac, a cyst of blood. They were like, it's called a chocolate-filled cyst. They, as in my physicians, my OB and PCP team, recommended me to a specialist, and that's what led to my surgery, and that's what led to me finding out that I did have stage 4 endometriosis with stage 4 lesions, and led to a 4.5-hour surgery. So I'm really thankful I got the surgery, even though I had complications, and it was pretty traumatic, so I definitely don't want another laparoscopic surgery again if I don't have to. So let's recap. It's only, between 4 and 5 centimeters. She doesn't want to do surgery unless it's 8 to 10 centimeters large, and that's okay with me as well. We're going to go ahead and do a x-ray where they inject dye through my cervix to see how my fallopian tubes are and how opatent they are. If you have ever had any of these surgeries done, comment down below what your experience was like. How were your physicians? How was your OB? Were all of your questions answered? And do you ever feel like you were dismissed, or do you ever feel like, yeah, I totally had all my questions answered and I felt like it was very professional? Because that's my case this time, but I've had both spectrums where I totally was dismissed and felt just almost gaslit, medically gaslit, and I had this experience where I felt very heard, and that's really amazing. And I think it's important to come with questions. I definitely kind of logged what kind of questions I wanted to ask, and that's really important because then you leave and you know you asked all the questions you were seeking answers to. And that would be my advice to you. Always log every single question you want to have answered and make sure they answer you. Always ask for risks and benefits of surgery, of not having surgery. I asked what are the risks of me having ovarian torsion, and she said with it being this small, probably not. If and when I do get pregnant, I will not have an increased risk of it growing. I also asked, how are we going to be monitoring this? Once a year, twice a year? She said we're going to be monitoring it through ultrasound, and it'll be once a year. So if I don't get pregnant this year, we will re-ultrasound my ovaries this upcoming December, so December of 2024. And if I do get pregnant, I'll be having a lot of ultrasounds anyways, and so we'll monitor it that way. It's nice to know that I don't have to have a repeat MRI because they are expensive. And I didn't ask, the only question I didn't ask was, what are the chances of this being cancer? And again, that would be really rare. And I'm not too worried about it for the simple fact that when I did have to get a DNC, and I'll explain what that is in another video, I had all my tissue tested. When I had my endometriosis surgery, I had all my tissue tested. And I've had multiple clear pap smears. I've never had any irregular pap smear. All my blood markers look good. And anytime I've had my tissue tested from a surgery regarding my reproductive system, it's all come back as endometriosis tissues, or like clear, essentially. Clear meaning that it's non-cancerous. I've also had the BRCA test to make sure that I'm not a carrier or in an increased risk of being a carrier of breast cancer or ovarian cancer. That test was negative, so that puts me at ease knowing I'm at a lower risk category of it being cancer. So I'm not really worried about that right now. If she's worried about that at all, I feel like she would have definitely raised her concerns or had more questions for me. So that's it. That was my appointment. This video was a little long. I hope it was informative, it was educational to you, it helps you or somebody that you know that may be going through this process. If you like this video, go ahead and give it a like, thumbs up, and share it to somebody that you know that it could benefit them in their health journey. If you know someone that struggles with fertility, endometriosis, IC, or any sort of reproductive health concerns and or issues, it would mean the world to me if you could share that with them just so that they know that they're not alone. If you have any questions, concerns, comments, go ahead and leave them down below for me so that I can engage with you and give you more content that would be beneficial for you. Hi, this is Shelby Sioux. I'm a nurse and I'm here to talk to you about all things health and wellness. This is my health journey. Thank you.